Hello, welcome to Midwife Dave. As you know, I'm called Midwife Dave because my colleagues struggle to pronounce my name, which is Piroshka. So this is another one of my videos in dealing with pregnancy, labour and birth. Today we're going to talk about pregnancy sickness. It's a very relevant topic at the moment. So what I want to talk to you about is the difference between normal pregnancy sickness and very serious pregnancy sickness, which has a great name, Hyperemesis Gravidarum. Okay, normal pregnancy sickness used to be called morning sickness because people thought it only happened in the morning. It can happen any time of the day. It can happen with background nausea that you're feeling all the time, or it can happen without any warning at all. Okay, it's perfectly normal. It won't do you or the baby any harm. The normal symptoms of pregnancy sickness are sometimes even before you've done your pregnancy test, you've had that metallic taste in your mouth, okay, and that just sort of lingers. And then as your pregnancy goes into the early weeks, that kind of becomes something that contributes towards you feeling nauseous and possibly being sick. You'll find that your taste buds will change, and that smells that you used to normally love, like coffee or tea, you cannot bear, and just the whiff will make you throw up. Okay, that's all part of the normal process. You can be violently sick, and then the next minute just turn around and be very hungry and want to eat something and do that quite happily. Make sure you stay well hydrated. Keep posting it in. Okay, so drink lots of water, really important, at least 3 litres a day. Very passionate about that. I bang on about that all the time. Yes, you will wee more, but you need that fluid, okay? Your blood volume is going to increase by 50%, so we need to make sure that you've got enough fluid on board. Okay, and also make sure that you eat little and often. Try not to leave big gaps between eating, and try and eat things that are going to be really good for you, that have got lots of nutrients in. Yes, you're going to want to snack on other stuff. That's absolutely fine, as long as that's not in excess, okay? You may find in the mornings that you do feel slightly worse, but you have had a long gap between eating. So make sure you've got something nearby, some biscuits or something you like to eat. Have a cup of tea in the morning. Take your time when you get up. Don't rush around. I know it's difficult when you're working and when you've got other children, but try and balance it, okay? Now, the body is great because it will go all out to preserve the baby and the pregnancy over your well-being. So don't worry. If you're being sick, and you're being sick quite a lot, generally your baby's going to be fine, unless you have any other complications, all right, or any other medical conditions. It'll be you that feels really bad, so you've got to take care of yourself, okay? Really important. Now, as I said, that can happen at any time of the day or night. Some of you might get it just in the early weeks of pregnancy, and it may fade and then come back, unfortunate, at the end of pregnancy. Some of you won't get it at all. And some of you will just be sick throughout your whole pregnancy. You may even be sick and continue that into your labour, okay? That's a really common thing. Now, Hyperemesis Gravidarum is very serious sickness. This is when you couldn't possibly lift your head off the pillow without vomiting, okay? You can't take the smallest sip of water without vomiting, and this is continuous. This will go on for days, okay? Don't leave it. If this has happened to you for a day and it's not the same as a tummy bug, okay, you won't have diarrhea with it. It will just be the sickness, all right? And you'll start to feel rubbish because your body will go into what we call ketosis, is when it sort of pretty much eats itself. That sounds vile, but what it does is it starts to use the muscles as energy because it's not getting any energy in anywhere else, okay? What you need to do is give us a ring. When you've got this condition, we will take you in, we will put an IV line up, okay? So we're going to put a little line in your wrist here, or your arm, wherever we can get it in. It's difficult when you haven't been drinking because your veins will collapse, but we will get one in, don't worry. And we put a drip up, and our job there is to rehydrate you. We've got to make sure that you've got enough fluid on board, okay? It's really important. And then we get you to the point where you can eat again. Generally, you'll be given anti-sickness. I have seen people given anti-sickness tablets, a bit of a waste of time in my mind if you're vomiting. You can have anti-sickness injections, so ask for those, okay? Really important. You need to start sort of feeling well again as soon as possible, really important. Okay, so hyperemesis, very different, very serious. You won't be able to tolerate even the smallest drop of water. Pregnancy sickness, happen at any time of the day or night, okay? You'll be sick, and then you'll be okay. Now, you may not instantly be okay, but you certainly will be during the day and be able to eat and drink things normally. And sometimes it just comes over you in a wave. All right, whichever one you've got, if you're worried, don't worry, ring us up. Don't feel silly, nothing silly, okay? We're used to it. That's fine, and we can give you lots of reassurance. But water, okay? And eat little and often.